Today, I will be giving a presentation on how AI is making it easier to diagnose disease. Computer algorithms today are performing incredible tasks with high accuracies at a massive scale using human-like intelligence. And this intelligence of computers is often referred to as AI, or artificial intelligence. AI is poised to make an incredible impact on our lives in the future. Today, however, we still face massive challenges in detecting and diagnosing several life-threatening illnesses, such as infectious diseases and cancer. Thousands of patients every year lose their lives to liver and oral cancer. Our best way to help these patients is to perform early detection and diagnosis of these diseases. So how often do we detect these diseases today? And can artificial intelligence help? In patients who, unfortunately, are suspected of these diseases, an expert physician first orders very expensive medical imaging technologies such as fluorescent imaging, CTs, MRIs to be performed. Once these images are collected, another expert physician then diagnoses those images and talks to the patient. As you can see, this is a very resource-intensive process, requiring both expert physicians, expensive medical imaging technologies, and is not considered practical for the developing world, and in fact, in many industrialized nations as well. So we can solve this problem using artificial intelligence. Today, if we were to use traditional artificial intelligence architectures to solve this problem, it would require 10,000, I repeat, an order of 10,000 of these expensive medical images first to be generated. After that, I would then go to an expert physician who would then analyze those images for me. And using those two pieces of information, I can train a standard deep neural network or deep learning network to provide patient's diagnosis. Similar to the first approach, traditional artificial intelligence approaches suffer from the same problem: large amounts of data, expert physicians, and expert medical imaging technologies. So can we invert more scalable, effective, and more valuable artificial intelligence architectures to solve these very important problems facing us today? And this is exactly what my group at MIT Media Lab does. We have invented a variety of unorthodox AI architectures to solve some of the most important challenges facing us today in the medical imaging and clinical trials. In this example I shared with you today, we had two goals. Our first goal was to reduce the number of images required to train artificial intelligence algorithms. Our second goal, we were more ambitious. We want to reduce the use of expensive medical imaging technologies to screen patients. So how did we do it? For our first goal, instead of starting with tens and thousands of these very expensive medical images like traditional AI, we started with a single medical image. From this image, my team and I figured out a very clear way to extract billions of information packets. These information packets included colors, pixels, geometry, and rendering of the disease on the medical image. In a sense, we converted one image into billions of training data points, massively reducing the amount of data needed for training. For our second goal, to reduce the use of expensive medical imaging technologies to screen patients, we started with a standard white light photograph acquired from either a DSLR camera or a mobile phone for the patient. Then remember those billions of information packets? We overlaid those from the medical image onto this image, creating something that we call a composite image. Much to our surprise, we only required 50, I repeat, only 50 of these composite images to train our algorithms to high efficiencies. To summarize our approach, instead of using the 10,000 very expensive medical images, we can now train the AI algorithms in an unorthodox way, using only 50 of the high-resolution but standard photographs acquired from the DSLR cameras and mobile phones, and provide diagnosis. More importantly, our algorithms can accept in the future, and even right now, some very simple white light photographs from the patient instead of expensive medical imaging technologies. I believe that we are poised to enter an era where artificial intelligence is going to make an incredible impact on our future. And I think that thinking about traditional AI, which is data-rich but application-poor, we should also continue to think about unorthodox artificial intelligence architectures, which can accept small amounts of data and solve some of the most important problems facing us today, especially in healthcare. Thank you.